All right, hello. Just wait for some people to get in from the waiting room. Let's see, we'll just give it maybe one more minute before we get started. All right, well, thank you everyone for joining us. My name is Melanie Stidham. I work for the Joint Legislative Audit and Review Committee, and I'm joined by my colleagues Stephanie Hoffman and Ashley Elliott. We're all nonpartisan staff to the committee, and we'll go into a little bit, we have a little bit prepared, but mainly this is a time for you to ask questions. We have a question and answer option, so down on the bottom, if you hover over the bottom, there's a Q&A box that you can click and you can type the questions, and Ashley and Stephanie are both monitoring questions. And then we'll address some of them during this, but feel free if you, or don't worry, if we don't get to your question during this time, we will try to address all those questions. And if we don't have your contact information, if we don't know who entered the question because it's a phone number or something like that, then we'll make sure we update the frequently asked questions document on our website. And so, again, we really appreciate everyone participating today and showing interest in our data collection effort. And so I'm going to start sharing a screen with a little bit that we have prepared. Let's see. All right, so this is about a school employee benefit board study. And I wanted to start just by, not all of you may be familiar with who JLARC is or who we are and why we would be asking for all this information. JLARC is a statutory committee of the legislature, and is formed by 16 legislators, and that's from representatives of all the major caucuses, and it's staffed by nonpartisan staff such as Ashley and Stephanie and myself. Our full office is 24 people. We conduct reviews at the legislature's direction, and so that means we get all of our studies through either bills or provisos. We answer the questions that the legislature has. So some of those are set in statute early, like with a sunset review, our office is automatically going to be looking at something to see how that was working. But other questions like this one are things that the has come up to the legislature, and they either want to know how something is working or they need more information to be able to make a policy decision. Part of our office and our we follow professional standards that are professional audit standards that are set by the Federal Government Accountability Office. So again, here's our study team, and it has our contact information here. So if at any time during this data collection effort you have questions and need answers, please reach out to one of us. Ashley is your go-to if you are trying to log into the system and something's not working technically, then that's who you contact. If you have other questions about content or complaints, then you can direct those to myself or Stephanie. So this particular study did come out of the last session. It was in Senate Bill 6189, and it came out of several years of trying to debate policy changes with eligibility of coverage. And so as they were deliberating some different options, they realized that they don't have some basic information on numbers of employees and the ranges of hours worked, so they would know how things were affected. And also, they've also been hearing that there have been changes in the amounts that districts are paying, or the amount of people who are covered now that weren't covered before, but don't have firm information on this. And so they wanted firm information about it. And it was originally thought, and when we first got this mandate, we really thought that we could get this information through OSPI and the Healthcare Authority, because they obviously have a lot of information and you already have to report a lot of information to them. But as it turns out with this specific mandate, then that information is not available. And the only way we can get the information is directly from districts, with an exception of the districts who use WSIPSI for business services. We can get some of the data through them, and we are doing so. We are audit staff, but this is not an audit. We're not auditing anything in this particular study. We are collecting information for the legislature so that they hopefully can make informed policy decisions. The data collection tool, I will admit, is a little bit daunting, and it's daunting to us, and I know it's daunting to you. Believe it or not, it's less daunting than it was before we did some tests with some districts who were really helpful in giving us feedback and making things more clear. But we do know that it is kind of big, and it's a big ask. And so we're thanking you in advance for even looking at it and for providing your information. But I wanted to, while it looks daunting, it's a little bit more simplified. And part of what makes it look daunting is that we have to ask the same questions over and over again. So I wanted to just start with the overview of what we're asking, and hope that it will simplify it a little bit on at least knowing what we're looking for. So there's 3 time periods that we're looking for that were directed by the legislature to look at. That's the 2018-2019 school year, so relatively easy. And then the 2019-2020 school year. And so that is a little more complicated because obviously SEB came into play midway through that year. And so the questions that we are looking at, a lot of those have to be pre-SEB and post-SEB, or during SEB, I guess. Within those 3 time periods, we're asking 4 main things. We're asking for the number of employees within job categories and the ranges of hours that were worked. We're asking for the number of employees that are eligible for healthcare benefits, the number of employees that waived health benefits, and then the amount the district spent for health benefits. Wanted to talk a little bit about employment categories. So we were asked for to look at this in specific employment categories, and we learned quickly on that there aren't necessarily the same job titles across districts. And so we are using the S275 data, the duty code roots, to select the categories. However, if you do have additional categories that you want to report on, then there's a way within the tool that you can add additional categories. But that's where we got our employment categories. We are asking for full-time definitions so that we can report the data on number of full-time staff and then part-time staff. But what we have found out is that it's not always easy within the data systems to identify full-time staff. And so what we're asking for are the ranges of hours, but then in order for us to be able to extract the full-time staff, we need to know what that means for your district. So, and for the different employment categories. And so we're looking for, there's a question that looks at hours per day and then days per year for the different employment categories so that we know who's full-time and who's not full-time. Within, there are a couple of questions that we've gotten, a few types that I wanted to go over within the sections, just questions that we've already received to cover, and then I'll be able to, and then we'll open up and we'll just answer your questions. So within the total number of employees, we are asking all districts this question for substitutes because WSIPSI doesn't have this information. And actually, nobody seems to have this information except for the districts. So all districts are asked to report on the total number of employees for substitutes. With districts that don't use WSIPC business services, then all the other employment categories, we're asking for that as well. And then we do need the total number of hours worked over the school year. This is because eligibility now with SEB is obviously that 630-hour threshold over the course of the year. And so we need to know the number of hours for the full year. If your data systems work in such a way that it's really hard to do that for all employees, then, excuse me, if you need to do a snapshot for most employees because they're under contract, so it doesn't really fluctuate that much for between month to month, then a snapshot of March 1st is fine. However, if it's employees with variable schedules, so March 1st may or may not be reflective of the full year, then we do need actual hours over the full school year. And then looking at the amount the district paid for health benefits, we're looking to quantify any changes in the amounts paid under pre-SEB plans and then under SEB. And so that's why we're asking this question. And then we're asking OSPI for the amount that's allocated within the state funding model. And we have a section of additional questions at the end of the data collection tool. And these questions were either asked to us by our committee, or they are needed to better understand any nuances in the data. I do want to note that with both the additional questions and questions that were before, at any part in the survey, we have a comment box at the end of every single page. And if you don't have the information, or for some reason there's additional pieces of information that we would need to be able to understand what you've reported, you can put that in the comment box anywhere. So it's okay that you don't have the information, you just need to tell us that. We do have additional information on our webpage that I wanted to point out. We do have the study team contact information, our study mandates there, frequently asked questions, which we'll update as we get more questions, and PDF versions of the data collection tools so you can look at all the questions in one place before opening up the platform and entering data. And so that is what we had prepared to talk about, and now we can answer your questions.
We have been receiving some Q&As that Ashley is trying to respond to now, but if there's anything from those Q&As that you want to further clarify, please feel free to ask them to us and we can try to answer them more directly.
Melanie, do you want to answer the question? We can answer it live, or I can also type your answer as well.
Yeah, which question?
Is this request mandatory?
Okay, the request isn't mandatory per se, so we are required to answer the legislature's questions, and we do have access to all information. But we don't really consider it that way. What we consider it as, we're trying to provide the legislature information that they can use in making their policy decisions. And so we are asking all districts instead of just a sample of districts, so that because we know that there's a lot of variation across the state and every district has a different situation. And so we are giving every district an opportunity to be able to explain or show what's happening in your district. And so this information will be used by the legislature in making their decisions. All of our information, we will be rolling up the data that we receive in different classifications of sizes of districts. And we'll be making the information from individual districts available so that members and legislative staff can look at the nuances across the state. So if you choose not to report, then your information is not going to be available, and then you'll be subject to whatever everybody else reported. Then it will be assumed that you're within those bounds.
We have 2 questions now about the December 31st deadline. If there's any way to extend it, it's apparently a pretty tough deadline, as some people don't work the whole month and all the other things that are going on. So I think that's a good one.
Yeah, fair enough. We chose that date in consultation with OSBI and several other districts, but if that date is a stumbling block, then please reach out to us directly and we can figure out a date. There is some flexibility in that, not a ton, but there is some. So please, yeah, do reach out to us directly and we can work on a date that works for both of us.
And then someone asked if we could go over question 24. They said it seems incomplete. I believe that's from if we wanted to look at the PDF.
Yeah, let me just scroll down and look for it.
I'm gonna look for it too now. So Melanie, I think it's the question for the non-WSIPSI districts. It's the number of classified employees eligible for SEB healthcare benefits in the 1920 school year.
Yes. Yeah, so this is, so for each question, we're asking for, we separate out the number of certificated staff and the number of classified staff. And so number 24 is for the number of classified employees that are eligible for healthcare benefits within that school year. So in this case, it is a little bit complicated because SEB came into play midway through the year. So the employee would go under the column that is their total number of hours worked for the school year, but we're looking for the actual number that were eligible once SEB came into play in this particular case. Does that answer your question?
And then I wanted to address this one really fast. We had a couple questions about it, if that's okay, about once you enter information, can you go back and save? And so we were told that our data collection tool could save. We, however, in testing have had kind of inconsistent results with that. So we do recommend that you use the PDF to kind of go through and fill out all the information, you know, whether that's printing it out or however you need to do that. And then when you go to enter it, you do it all in one go. However, if you are feeling brave, you are welcome to try and test that feature. We can't guarantee it will work though, so that's why we don't recommend it. But if, in theory, if you use the same link from the same computer, same everything, same IP address, same, you know, all of that, it's supposed to save. But like I said, we had really inconsistent results with that, so we can't recommend it. We would recommend that you try and, you know, fill out using the PDF or some other manner so you just can enter it all at once and not have to worry about that. I just wanted to address that because I got that a couple times. So yeah. And then we also had, how would we define health benefits? Does that mean medical, vision, dental, like the LDT, all of VIVA, all of that stuff?
Yeah, the health benefits are medical, dental, and vision. I believe how SEB defines it is how we're defining it.
So anything that's fully paid by the employee would not be included as a benefit.
Right.
And
sorry, go ahead, Stephanie.
Oh, I was thinking, Ashley, you did answer this, but I know we've received it from several districts about why January through August, why we're asking about January through August and the September through December 2019 timeframe and not the full school year. And I'll take a stab at answering this, and Melanie, please jump in. But when we wrote the survey, those time periods were really just to illustrate when SEB was implemented. So September through December is the pre-SEB healthcare plans, and January through August is the post-SEB or the actual SEB implementation. But when we're asking about range of hours for employees, we do want you to think about them as their full school year and the hours that they worked for the full school year. For us, we will categorize the portion that reflects the time period before SEB and the time period once SEB was implemented. But we understand that those dates up at the top may be confusing when you're reading it through. So if you do have more questions on that, please feel free to ask us.
We had a couple more questions I think that are good to answer live. So one is for the 2019-2020 reporting period, it seems we are to report enrollment and waivers and costs for January through August, but for the same time period, are we to use the hours worked anticipated for September 19 through August 2020, which is how they determined eligibility? Or are we to use hours for the prorated school year?
I think that's similar to what I was just discussing. But if I'm not answering it, please ask again. But we are looking at the full school year of hours, and those dates that are up at the top are really just reflective of when the different health insurance plans were in effect.
And this one I think is also important. It asks, doesn't SEB or the HCA have the answer to the question about who waived coverage from January 2020 to August 31st, 2020?
Yeah, that's a really good question. And they do. They have it under individual level data, and but the HCA does not have any information on the job category, including on even if they're certificated or classified staff, and we're asked to look at it by job category. And so HCA, without having to first ask you for every employee's individual level data and then comparing it to HCA, we can't really answer that question. And so that's why we're asking it of districts directly to try to, because we are trying not to get individual level data for this.
Someone asked if we can talk about reporting for substitutes again. They don't really understand maybe what the questions are.
Yeah, so I wanted to go back to the number 24 in the PDF that was actually with SIPC, the SIPC data collection tool. So I just went back, and that actually has to do with substitutes as well. So I'm going to answer that one first. So that's that question is how many substitutes are anticipated in the 2020-21 school year, and so I just want to apologize, first of all, about this question in general, because this is not an easy question. We were asked directly to include this. And so, and I understand that it's confusing and difficult to answer. So what the legislature is trying to understand are impacts to your substitutes going forward in this coming school year, well, this school year we're like right now. And so, trying to get a handle on how many people are going to be affected and maybe losing their benefits. And so if your answer is a number 6, then great. If it's we have no idea because we're still remote, or that's fine to put as well. That again, with all of these questions, if you don't have the information, then that's perfectly acceptable to tell us that you don't know. But anyway, that is what they're trying to get at, is just trying to understand for this school year how many substitutes you might have, and trying to go, and then they would want to compare that to the numbers that were already reported to see if that number was increase or decrease. Then let's see, with substitutes in general, we have, so let me scroll up here in the PDF. Sorry for talking while thinking. Okay. let's see. So with the substitute teachers, so for those districts that, well, for all districts are going to be reporting on this number of substitutes that you have by range of hours worked. However, for districts that are not using WSIBC's business services, then substitutes is just another row in the table that you're already filling out. But for the districts that we're getting some data from WSIBC, they don't have any information on the substitute teachers. And so we have to ask that directly of you. So then we're asking the number of substitutes that we're working by ranges of hours for the 2018-2019 school year, and then the 2019-2020 school year. And then the number of those substitutes for those same time periods that were eligible for health benefits, and then that waived health coverage if they were eligible, and then the amount that the district paid where applicable.
Okay. Sorry. Someone is still asking about that question 24. How many substitutes are anticipated to do what? Is that like work or work more than 630 hours? Or are we just asking? So I think just a little bit of clarity, and we might want to clarify that question in the actual survey or data question.
Yeah, I think I noticed that we actually have a typo in that sentence. So
it's a little confusing.
But anyway, so what we were looking for and what we'll update. So I really appreciate you pointing this out so that we would be able to go and clarify this. But anyway, so how many substitutes are anticipated to work in the 2020-21 school year? And then how many are anticipated to work less than 630 hours? So the total number that you anticipate to work, and then the question 25, and the numbers are different for the larger data collection tool, but the question is the same. So then how many are anticipated to work less than that 630 hour threshold?
And then we have a couple questions about substitutes. Are we asking about all substitutes, or just certified teacher substitutes, or classified substitutes?
Yeah, that's a great question. When we were pulling the information out of the S275 duty route, the instructions on how to report, then that duty route was 55, which I think is certificated instructional staff. But if your district has most of your substitutes turn out to be under the classified, then we'd appreciate if you could add that as a category and just let us know that that's a category that we missed.
And then we have a couple questions that mention the purpose of the study, and I think we went over a little bit in the beginning, but maybe if we could just reiterate that.
Yeah. So the purpose of the study, so this study came directly from the legislature of wanting to know. So I want to be clear that we did not make up these questions or decide to do this of our own interest. This is a question that's coming directly from the legislature, and they are looking at wanting to know the changes in coverage eligibility pre-input, under plans before SEB and then under SEB, because they are hearing from districts and from others that those the amount paid and the number of people covered is changing. May have changed, but they're not getting firm numbers. So they don't know in what ways did it change. And they're also not clear on if they made a policy decision changing that eligibility threshold or the state funding model or any other things. I'm not promising they are changing that, but if they were going to, then they don't have the information to make an informed choice. And so that's what we are trying to provide to them, the just basic information so that they can make informed policy decisions.
And we have a couple of these questions about what if we can't give you all of the data or all of the timeframes or any of all of that. I think that's a really important question to answer.
Yeah, that's great. We would far prefer a partial response than no response. And so if you don't have all the information, then that's perfectly acceptable to us to write that into the comment box. Like, we don't maintain this information, we can't give it to you for whatever reason it is, then please just let us know. And it will warn that we are going to make all the individual responses available through an appendix of our report. And so just be aware that if you have something to privately tell us, then you should send that in a different channel than on the survey.
I'm also noticing, Ashley, we're still getting some questions about the time frame and how districts should report hours worked for the January through August timeframe. And again, apologize for confusion around this, but we really are looking for the full school year hours worked. And those dates of January through August just reflect, it was a reminder to us and to the districts of when SEB was implemented. For you who are working with these health plans, I know that those numbers are probably ingrained in your head more than it is in ours, but just think about the full school year whenever we're asking about range of hours worked for any of the employees and for both school years that we're looking at.
And it says, is it to compare total costs or out of pocket changes? Oh, I'm sorry. I think that was related to the purpose of the study. I apologize. Someone asked, it seems that the data should correspond to the plan year, January through December, rather than the school year. It's more difficult to gather data for 8 months than a full year.
Yeah, and again, that's just because that's when SEB came into play. So we're really trying to understand the differences before SEB. So whoever was eligible, or maybe had a different plan before SEB, and then once SEB came into play, then they were either now eligible or were now not eligible under SEB. So those are the real differences that we're trying to capture, are the pre-SEB world and the things that changed under SEB.
And then for the costs reported under SEB 19 to 20, do we report the required contribution from the state for a benefit eligible employee? This would be the same amount per eligible employee, even if the employee was medical, or do we add up the employee and the employee premium costs of medical, dental, and vision?
These would be any costs that the district is paying.
Just the employer costs, not the employee cost.
Mm-hmm. Yeah, and we've had a couple questions about, can we clarify what information WSIPSI is providing and what information the districts need to provide? And I answered this question earlier, and I'm happy to, there's 2 versions of the survey. I'm not sure, we sent out 2 separate emails. So if you were a WSIPSI district or a district that WSIPSI is able to enter information on behalf of you, you got a more truncated version of the survey than if you were not. So they're actually on the website, and in the introduction to the survey and in the PDF, we do talk about what information WSIPSI is providing on your behalf. And you are also welcome to talk to WSIPSI about that if you have more in-depth questions on the information they're providing on your behalf. But like I said, the differences you can look at if you'd like to go onto the JLARC website, which was in the email. We do have both versions of the data collection and a PDF for both versions available as well. So if you wanted to compare those, you're welcome to. And I did put the links in the Q&A earlier. So I just wanted to clarify that we did make that information available in the answered questions.
Yeah, and then in general, WSIPSI, we're able to get the information from them on the total number of employees that by the employment categories and the ranges of hours worked, the number who were eligible for benefits, and the amount that the district paid. WSIPSI is not able to provide any of that information that I just mentioned, though, for substitute teachers, and they are also not able to tell us how many employees waived coverage. And then there's also some of those additional questions that are about job shares or anticipated number of substitutes for this coming year. And there's a couple of others. WSIPSI doesn't have information on that. And they also don't have information on the full-time definitions.
And someone says that we do not report our substitutes on the S275, so they do not have a duty root code.
Yeah, that's totally fine. What we were only using that to try to be more clear. If it's not clear, then I apologize for that. So this is, so the substitutes that we are mainly thinking of are the instructional staff, are the instructional substitutes. But if you have a lot of substitutes that are certificated, then please do report those and just note that. In that case, you'd be adding an additional category.
Yeah,
and that will
then,
be clear in the data collection tool how to do that.
Someone also said that it was just a comment, but I think it's worth mentioning that one of the things that isn't addressed in this request is what kinds of decisions we were faced with based on employees approaching the 630-hour threshold. Many districts had to manage use of part-time employees by cutting short employees' work year, delaying or ending early, or reducing hours per day. And we understand that isn't it's not something that we asked, but if you feel like some of that information needs to be known, we do have comment boxes that we encourage you to use, remembering that of course your responses will be published. And there's also at the very end of the survey, we do ask if you have anything else you'd like the legislature to know. So those are both places where you can put that information. We understand that the questions aren't going to get everything, all the nuances, so we wanted to give you opportunities to provide that information to the legislature directly. And then, yes, someone sent out the information. WSIPSI is helping us, and they have, I think they should have sent out some information about what they're helping us with. So I'm just gonna move this question over so people can see that it's there. Who was the notification sent to at the district level? Many districts had no clue that this was even happening until they got an email forwarded around. Yeah, that's.
So we tried to get, we used the OSPI distribution list for superintendents, and then we were also trying to get, so we understand that in a lot of districts, the superintendent is probably not the one that's going to be actually responding to the surveys. So we tried to look up either the business officer or the chief financial officer, or somebody else on staff that seemed like they would be the ones responding. And so we did get one list from an association, and so that was really helpful. And then if we didn't have more than just the superintendent, then we tried to look up each district's website. And so we tried to send it to at least 2 people within each district. And so it's possible that that method had some shortcomings. So I apologize if it did, if you only ended up getting it by a forward, but we do appreciate that you eventually got it.
Yeah, and if you are the correct contact person or it was sent to the wrong contact person and you'd like to have us update our contact list, or please just you're welcome to send me an email. I'm the one that sent out the original email, so you can either reply all, or please don't reply all, reply to me, or however you need to do that, and we will make sure a contact list is updated. Another question, so it says, if an employee is required to have dental and vision but waives medical, that employee is considered not considered as waived. SEB does not allow waiving dental or vision. So
correct. So in that case, we are just looking for those who have waived their medical coverage. We do know that that they can't actually waive the vision and dental, but we're really just looking for those that have chosen to waive their medical in that case.
Yeah. Someone asked, can OSPI send a glove delivery something to reach a greater population? Just know that the superintendents don't always forward on their staff. We do know that, and we are trying to work with OSPI to get a wider reach, but we're having some trouble with that. We did reach out to WASBO and another HR organization, and I'm sorry, I forgot the name of it. So we are trying to use resources to get the word out to as many people as possible. So like
yeah, if anybody on here does have contact to an organization that could help with getting the word out, we would really appreciate that.
Yeah. All right. Someone asked when this was first requested.
We got this study during the 2020 session, so I can't remember what it ended, but it was sometime in June that we got the mandate, and then we've been working since then on, first of all, understanding what exactly the mandate said, and then working with OSPI and some districts to help us better understand, and with Healthcare Authority as well, on understanding who has what pieces of data, and then also crafting the survey and testing the survey and getting feedback on the survey. So we've been working on all that since then, and then just released the data collection tool itself.
As of right now, that's all of the questions. I don't know if anyone has any we haven't answered. How is this study impacted by the governor's order?
I'm assuming that's the governor's order to keep benefits. And so I'm going to answer as if that's the case. That actually in some ways kind of helped for our study purposes, because then it kind of kept it sort of like 2019, 2020 was sort of a normal year. Maybe that's the only way it could possibly be classified as that, but because coverage wasn't dropped if somebody had it. So it's, so in terms of just looking at a number of employees that were eligible for benefits, the order kind of kept that steady. The only group of people that we won't have good information for are the people who would have met the threshold, the 630-hour threshold in, say, March or April or May or June. Then we're not going to know if they did or didn't, or yeah, we won't know much about them.
One more question. So apologies, they missed the answer earlier if they did. For questions 1 and 2, we have paraprofessionals, duty code 91, with multiple union agreements that define their full-time statuses differently, both regards to daily hours and work days per year. While we don't want to report each of these groups separately and all the questions, can we provide details in the comment section, or does the data entry tool allow for multiple lines of entry?
Right. Thank you, Marnie, for this question. And I've been thinking about this question because you sent the email earlier and I just haven't had a chance to respond. And so let's talk about, this is kind of a specific situation. So let me get back in touch with you to talk about the nuances of your data. And this is a great example of within your data system, if there's some kind of thing that the way you report it could end up looking odd to us or different, then please reach out to us, because we can come up, we don't want to, we definitely do not want to increase the reporting burden. And so we just want to be able to understand what's reported. And so, I will be in touch with you very shortly, Marnie.
Oh, and
if anybody else has a similar situation, just with something that's with your data that you want to talk to us about, then please do.
Yeah, there was another question. I'm sorry, I might have accidentally answered it or not. I don't remember. About the deadline, again, about the December 31st deadline, please reach out if you have any issues with that and are not sure you can make it. We will eventually, I understand that the study isn't due for another year, but we do eventually have to cut off the data collection date because we have to have time to analyze the data. So we will want to work with you on an individual level if you need some more time. So do please reach out to us and we will do our best to work with you on that. But we aren't going to give a blanket at this time, a blanket different date. So please just, if you're struggling or it's a barrier, it's going to be a barrier to you answering any of the questions, please do reach out to us. And like I said, we're happy to try and work with you. Are there any other questions? I tried to get to them all. someone says even a week or two into January would make a huge difference. Like I said, we will continue to evaluate this and we will let you know. But like I said, please just reach out if you are if you're gonna need a little bit more time, and we will make a decision based on all of those factors if we decide to do a blanket change or anything like that. So we will definitely make sure if we do anything like that, that it is well advertised and known. So
yeah.
Ashley, it looks like we're getting just another question about with SIPC districts, if they received a different data collection tool. You did receive a different email and data collection tool. So every question in your version of the data request are pieces of information that we could not get directly from WSIPSI. WSIPSI is providing us with all the information that they could provide us for your district, and then whatever's in the data collection tool is what remains. And if you have any specific questions about what SIPC provided, please just get in touch with us and we can give you a little bit more detail on that.
Yeah, so mostly it's just slightly truncated. The non-WSIPSI districts have more in-depth of all of the questions. Your questions, some of them are much shorter. So like I said, you happy to get in contact with us, but they are also, both versions are available on our website if you wanted to take a look at them and just see the difference. Like I said, there's a PDF and a non-PDF. We tried to be very clear on how we labeled them. So if you have any questions, you're welcome to contact us or look there. We also have a list of where districts fall. So if you're not sure which one you received, you're welcome. You can also check that out, again, on the website. But again, reach out if you do have any questions like that. We're happy to help you.
Yeah, and if WSIPSI is still on this call, we really appreciate your help. They've been extremely helpful in both, well, providing information for a lot of people and also for helping us clarify the questions before they went to you and you know, to the rest of you. So they've been really a great resource and we appreciate it.
And we are going to work to try and make this available on our website. I'm not 100% sure we have all of that worked out, but if not, at the very least, we are going to be working on putting this Q&A that we've answered. Even if we've answered them live, we'll make sure that we incorporate those in the frequently asked question document. So if this isn't able to be made available, you will at least have access to the questions that were asked or that came up a lot. And there are words missing from the WSIPSI PDF 24 and 25. We will be fixing that. So yeah,
but the question is, basically the question is, yeah, so we're going to fix that. And thank you for pointing out that we're missing the word. But anyway, what we're looking for is the number of substitutes that are anticipated to work in this school year right now. And then the number of substitutes that are expected to work less than 630 hours. And that's a specific interest of the committee wanting to know this to try to anticipate what changes are coming. And that's more related probably to COVID.
So, are there any other questions? We have just a few more minutes left. So we want to make sure we got to them. You're welcome. We're really happy. We really appreciate you guys taking the time to get on here and ask questions. We also really want to encourage you to send us an email if you have any questions. We understand that this is a really big ask, and so we want to make ourselves available to you to provide as much guidance as possible.
Yeah, and we do really want to reiterate, we appreciate you providing your information to us, that there's a lot of anticipation for the data that we're collecting to be used. And so I do want to assure you that this information is going to be used, that it's not a waste of your time to do, that there is keen interest in the information you're providing. And we do really appreciate you taking the time to provide any information that you can to us. It's extremely valuable and we really appreciate it.
And then we did have one more question. Do you want us to report substitutes that have continued coverage due to the governor's orders?
That's not something that we really do try to stick within what the mandates are to us. And so, if you have the information readily available, you can feel free to put it in a comment box, but it's not something that we're going to be asking of all districts.
And then another one, we keep substitutes employed in our system even if they don't work. Do you want a count of all or a count of those who work during the year? The counts are different in both cases. I think this might be referring to the 2021 questions we asked at the very end. Correct me if I'm
Probably, I guess it would be, yeah, that's a good question. If it is for the this current school year, then yeah, the number that you have, and then the number anticipated to work less than 630 hours. So that, if that answers the question. Then you can also make notes. I believe that field is available for being a number and text. So having some kind of clarification on the number that you report would also be helpful. All right, well, thank you again, everyone. We really do appreciate all of your questions and for your participation. And as Ashley has said, please do reach out if you have additional questions.
Thanks.
Thank you.
Bye.
Bye.